Thank you for joining the wellness program at Duren's Pharmacy. Today we will be discussing the basics of blood pressure. Today we will learn about what is blood pressure, why is blood pressure so important, what is a normal blood pressure, and what causes high blood pressure. So let's get started first with what is blood pressure. The circulatory system is a delicate system of hoses that carries blood to all the organs of the body. The blood vessels are made up of thin layers of muscles and elastic-like cells. Blood pressure is the amount of pressure applied to the walls of the vessels as the blood flows through them. As blood flows through our blood vessels, it creates an outward pressure on the walls of the vessel. This is what we are testing when we check your blood pressure. Let's take a garden hose for example. Surely everyone has watered the garden or washed the car before. Have you noticed how the garden hose feels before you turn the water on? The hose feels sort of limp and spongy. Now think about turning on the garden faucet halfway. The hose fills up with water and it's not as spongy as it was before. Now think about turning the faucet all the way on. The pressure inside the hose increases a lot. You may not be able to pinch the hose now that is full of water. This is similar to how the blood pressure in the vessels works. We will take a look at a few reasons why the blood pressure might be elevated in a few minutes. Why is blood pressure control so important? Did you know that an estimated 1 out of 3 adults in the United States has hypertension or high blood pressure? This includes people that did not even know they have hypertension. Only half of those who know they have high blood pressure actually have their condition under control. You may ask, how do people not know they have hypertension? The scary part of high blood pressure is that there are no symptoms of the condition. Hypertension is known as the silent killer because high blood pressure often goes undetected while slowly causing damage to the heart and circulatory system. The only way to know if someone has hypertension is by regularly scheduled health screenings. High blood pressure contributes to an increased risk of heart attack, stroke, and heart failure. It is very important to get your blood pressure under control to avoid these health complications. There are some factors that increase our risk for developing hypertension. Some of these include advancing age, having diabetes, high sodium or low potassium intake, being overweight or obese, lack of exercise, alcohol and tobacco use, race and ethnicity, and family history. We will talk more about these in depth and ways to improve your health in future videos. The American Heart Association gives healthcare providers guidelines on the proper diagnosis and treatment of heart conditions such as hypertension. The blood pressure of a person can change frequently throughout the day and is affected by activity levels, drinking caffeinated beverages such as colas and coffee, smoking, and stress. In order to diagnose a person with hypertension, the blood pressure needs to be checked frequently to get an idea of the average blood pressure. The American Heart Association tells us that the normal blood pressure for adults should be less than 120/80. If the blood pressure is between 120 to 139 on the top or between 80 to 89 on the bottom, this is considered pre-hypertension. Consistent blood pressure readings in the pre-hypertension range means this person is at a high risk of developing hypertension. If the top number is 140 or higher, or the bottom number is 90 or higher, the person is said to have hypertension. Let's take a look at some examples. Let's say a person's blood pressure is averaging 116/86. The top number is in the normal range, but the bottom number is in the pre-hypertension range. This means the person has pre-hypertension. Let's say another person's blood pressure is averaging 148/74. The top number is in the hypertension range, and the bottom number is in the normal range. This means the person has hypertension. After gathering several blood pressure readings and seeing how your blood pressure is running, we can decide how aggressive we need to treat the elevated blood pressure. Some people may be able to reduce their blood pressure to normal through lifestyle modifications, while others may need the addition of medications. Over the next few weeks, we will discuss ways to improve your blood pressure and health through lifestyle modifications. We will also discuss medications used to treat hypertension. So what is the difference between the top number and the bottom number? The top number, the systolic pressure, tells us the amount of pressure in the vessel at the time the heart makes a beat. The bottom number, or diastolic pressure, tells us the amount of pressure in the vessel when the heart rests in between the beats. One way to remember which number is which is by using the phrase sun over dirt. We can think of the line as being grass, the sun in the sky, and then the dirt underneath the grass. And then S is for systolic and D is for diastolic. There are two main things that affect the blood pressure: excessive fluid in the vessels and constriction of the blood vessels. Let's talk about each of these separately. Who doesn't enjoy watching or having a water balloon flight on a hot summer day? Let's use that as an example of how excessive fluid can increase the blood pressure. As more and more water is added, the pressure pushing out on the balloon keeps increasing. If you fill the balloon until it is extremely full and very tight, the water will exit the balloon at a very high pressure when it is popped. Although your heart is not going to pop like the water balloon does, excessive fluid and high pressure in the blood vessels does cause the heart to pump harder to move the blood to all areas of the body. Now, how does vessel constriction or narrowing increase blood pressure? Let's take another look at the garden hose. If the hose does not have a sprayer on it, the water comes out the open end in a nice steady stream. If you put your finger over the end, this creates a narrower opening for the water to exit, similar to constriction. The water exits the hose at a high pressure. As with the water hose, if the blood vessels constrict, the heart has to pump harder to get the blood to all areas of the body. In future videos, we will be discussing in more depth ways to improve your health and blood pressure. Topics will include diet, exercise, and medication therapies. You never know what you might learn. Next week, we will be discussing an overview of diabetes. If you have any questions about hypertension or need assistance with your medications, feel free to contact Meg and Carol, pharmacists at Duren's Health Mart Pharmacy. Don't forget to stop by the pharmacy sometime in the next week for a blood pressure check. You are invited to join us at Duren's for our monthly Healthy Heart Club meeting. Bring a friend and join us as we learn about heart health. We meet the second Tuesday of every month at 7 o'clock p.m. at the pharmacy. Thank you and have a wonderful week.